Hello and welcome to the Global Journal of Medicine and Public Health podcast. I am your host, Lishasha Paudel, an advisor at the Global Journal of Medicine and Public Health. This is an exciting moment for us as we launch the very first podcast of the journal. Our aim with this podcast is to spotlight articles that hold significant relevance in today's healthcare landscape. For each episode, we will select one standout article from the latest issue of the journal, invite the author to share their insights, and dive into a discussion about their research. So, in today's episode, we are discussing the article titled Antibiotic Overuse by Jamaican Clinician in the Treatment of Pharyngitis in Children. We are thrilled to have the primary investigator of this article, Dr. Johannes Rodriguez, join us today. Dr. Johannes is a medical officer at University of West Indies in Jamaica. Dr. Johannes, thank you so much for joining us today.
Thank you so much for having me, Sasha.
So, Dr. Johannes, your study addresses the critical issue of antibiotic overuse in treatment of pharyngitis in children, a problem that fuels antibiotic resistance globally and locally. So, by examining the attitude and practice of clinicians, your research sets light on this significant challenge. So, let's dive into your research journey. So, my very first question to you is, what were the feasibility challenges of conducting this cross-sectional study? For example, coordinating with 337 practitioners across 19 specialties and reviewing over 7,000 medical records sounds like a monumental task. So, how did you navigate this hurdle, Dr. Johannes?
Right, thank you for asking. Just some background. This part of the research, is part of the antimicrobial stewardship component of a larger research that looked at rheumatic fever. And the
Mm-hmm.
whole research was really centered around 4 or 5 components of data collection and 4 or 5 different objectives. And I must say, in terms of feasibility, the data collection was without doubt the most difficult component
Mm-hmm.
of the study, or the most of the study, and even this component of the study. This included data collection using a virtual approach, approaching clinicians to fill out a questionnaire, and it
Mm-hmm.
was with all the efforts in the world, I got a less than 10% response rate. And I had to now branch out to different methodologies to fulfill my sample size. So clinician participation was part of the data collection issue because clinicians were very apprehensive in participating, whether it be because, and this is all informal, this is what they told me, this is not part of the data collection, but they were apprehensive because of lack of familiarity with any diagnostic approaches to pharyngitis,
Mm-hmm.
with unfamiliarity with recognition of rheumatic fever, acute rheumatic fever. And also, they just didn't have the time or interest to partake in any data collection activities or research activities. So without doubt, the data collection was really hard. This
Mm-hmm.
part of the research not only looked at responses from clinicians, but also delved into health records. I would have had to look for 356 health records to fulfill a sample size or a little bit more to get the information to objectively compare what clinicians were saying against the data within the health records to see if they fulfilled specifically what we're looking for, which was the Centaur criteria. The Centaur criteria is a criteria for diagnosing group A streptococcal pharyngitis. And one of
Mm-hmm.
the difficulties, the feasibility in the data collection with this is that there are a lot of records that were incomplete or that um, had the clinician visit or the patient visit, but lacked a lot of the components that we're looking for. So we had to, although we said we would have done a random sampling for the health record component in specific health centers, we had to expand it significantly to maintain the
Mm-hmm.
randomness, we had to expand the number of health records from a larger number of centers so that we could fill the sample size with completion. So without feasibility, it comes down to data collection.
Mm-hmm. Yeah, it's incredible to know how you manage to gather and analyze such comprehensive data. So,
Thank you.
moving on, what inspired you to undertake this research? Like antibiotic resistance is a significant issue. So, was there a personal connection or perhaps an observation in clinical practice that drove you to address this particular challenge?
Okay, I'll be honest with you. As I mentioned before,
Okay.
was part of a larger research endeavor, and I
Mm-hmm.
really was apprehensive to start in the first place. It was my professor, my supervisor while doing my doctorate in public health, that asked me to pursue rheumatic fever. And in writing the proposal, it kind of snowballed into this component, and I realized the significance of including this since we're doing such a large endeavor and data collection procedure. Might as well we pursue this very important factor. And I must give it to Dr. Tom. She's also part of our research team. She works a lot in antimicrobial resistance and antimicrobial stewardship. And she would have given me insight over the years. So all these components would have combined to increase my interest in finding out specifically in the Jamaican setting how
Mm-hmm.
uh, physicians consider antibiotic use and then
Mm-hmm.
target it now to group A pharyngitis, group A
Mm-hmm.
strep pharyngitis.
Yeah, so that's fascinating to know. The issue of antibiotic resistance is indeed pressing. So moving
Yes.
on, how did you approach understanding the novelty factor of this research? Like, did you conduct a thorough literature review or identify specific gaps in clinical decision rules? Like, how did you understand the novelty factor of this particular research?
Uh, so in our data collection, sorry, our literature review would have found some gaps in the data, especially locally in Jamaica, where
Mm-hmm.
would have concerned this kind of cross-referencing, cross-referencing meaning the clinician knowledge, attitudes, and practices to the
Mm-hmm.
outcomes in the patient management. And this is where the health records would have come in. So this cross-referencing to see where they overlap or where the gaps in hasn't been fully explored locally. Uh, and even if you do it internationally, there there there's a paucity of research studies that will give it this cross-sectional review. And when I say cross-sectional, I mean cross inter intertwined review of two different components and where they overlap. So that was a
Mm-hmm.
novelty factor for me. Um,
Mm-hmm.
Comparing objective center staging with doctor prescribing habits.
Yeah, that's really insightful. So, research often comes with ethical consideration. So, my next question to you is, were there any ethical challenges during your study? For instance, did you face any difficulties in obtaining consent from the clinician or patient or adapting protocols during data collection, Dr. Johannes?
Okay. No, there were no major ethical challenges. The major
Mm-hmm.
ethical challenges was just getting a proposal to be accepted by our ethical review committees.
Mm-hmm.
I'd say it was just refining the proposal. But in terms of
Mm-hmm.
getting consent, or any other thing like that, there were no significant challenges. It was pretty straightforward after the where ethics is concerned. It was pretty straightforward after ethical approval.
Mm-hmm. So there were no any ethical challenges.
Not not
Um,
not not that I can report.
okay, so as we move to the end of this session, lastly, I wanted to know that your study has such a practical implication for clinical practice and policy. So, how did you determine its relevance for policy or clinical practice? Like, do you envision your findings being used to revise any department protocol or even contribute to national policy making?
I do. I do. And particularly where it concerns the elements of the center scoring. Like, center scoring is really a clinical decision rule. And we would
Mm-hmm.
have liked it for clinicians, and it was expressed in the body of the research that 99% of the clinicians expressed that they would like a national clinical decision rule or a policy or protocol for diagnosis of group A strep. So this was one of the rationales, and the relevance in terms of pushing the health sector, or I should say the Ministry of Health and Wellness, to move towards a national protocol that they can disseminate, having validated center scoring in our population. And
Mm-hmm.
of course, linked to this is the approval and integration of rapid antigen detection tests. So this would rationalize introduction of a rapid antigen detection test locally. So it would be three components: the rapid antigen detection test, the clinical decision rules, and clinician education, all towards antimicrobial stewardship and the
Mm-hmm.
spin-offs and benefits that come from it.
Mm-hmm. Yeah, so Dr. Johannes, your insights are invaluable, and I am sure our listeners are gaining a deeper understanding of the research process and its implication. Thank you so much for sharing your journey and finding with us today, Dr. Johannes.
Thank you so much for having me, Sasha. I should say Dr.
Uh,
Sasha.
Yeah, so to our listeners, thank you for tuning in to the inaugural episode of Global Journal of Medicine and Public Health podcast. Stay connected for more thought-provoking discussions with authors whose work is driving meaningful change in healthcare. Until next time, take care and keep making an impact in your field. Bye bye.